what does road to recovery look like? You've been doing chiropractic, you've been doing physical therapy, you've been doing rehab, but you don't know where you stand in your road to recovery. This video is all about that, so stay tuned. All right, so I've done videos on chiropractic treatment for rehabilitation, physical therapy for rehab. So this has to do with musculoskeletal conditions, chronic musculoskeletal conditions, chronic re-injuries, or injuries, or not chronic necessarily, repetitive. And you've been doing postural neurology, you've been doing functional rehab like dynamic neuromuscular stabilization, either in my office or elsewhere. Frankly, I don't know any other offices that do both of them except for mine, but this is not about that. The question is, how do you know where you're at? How much longer in the rehab do you need to be traveling through? So the best thing to do is, obviously, at any quality type of rehab, it's one thing to do the exercises, either postural neurology exercises and or functional rehab like DNS, dynamic neuromuscular stabilization exercises. It's one thing to do them, but the quality care is when you're actually educated about this machine that you have, just like that cell phone. You can have a cell phone and use it for a phone call, but we all know we don't do that anymore. There's so many nice features, and we take the time to educate ourselves about the different features of the cell phone. So unless you take the time to understand this machine that you own, you're not going to be taking care of it. You're not going to utilize it properly. You're not going to be making it last as long. So quality rehab is going to require some degree of education. Like it or not, that has to happen. If you don't like it, then be prepared to be constantly having the pain and constantly re-injuring yourself. So if you don't like it, the requirement is to take the time to get educated, and hopefully that comes from the practitioner, the doctor that or the therapist that you are receiving the care from. When you are able to do your normal chores, normal tasks, normal routines, implementing those principles, then that means your brain you're not teaching it, has accepted and resumed those principles like it was supposed to have, that you were supposed to have. And then you catch yourself not doing it correctly. So the first step is when you notice, oh, something's not right, or you notice in other people doing the work and movement improperly.
Thank you very much.
All right. So we're going to keep it quiet and not pause here. So this is candid. This is what happens in the office when I've got 5 minutes and patient comes right out of the door. But back to what we were talking about. So first thing is when you recognize, hey, that person's not doing it right, that person's posture is not right, or my posture is not right. But in action, for example, this morning I was blow drying my hair, and I noticed as I'm blow drying my hair, in the old ways, and most of you would be doing it, those women who blow dry, if you guys are guys, then maybe even brushing your hair or something, or maybe lifting something. Using your trap is not necessary. So if your scapula, your shoulder stabilizers are able to keep the scapula down as you're doing stuff that don't require their movement, then your brain has accepted and resumed the proper functional movement. These are the steps, very subtle. If you slow down to look for it, you will see. And those are the cues that you're definitely becoming the very principles that your therapist or your doctor has been trying to instill in you. These are some of the questions my patients ask me, and it always, every question in essence comes back with a question from me, because I want my patients to ask the right questions and hopefully have the answers. And obviously, if not, then I can help them with. Anyway, I hope this was important and applicable to your life and your questions. Make sure you visit my website, find out what it is we do. If we can be of any help, by all means, contact the office, and check out the YouTube channel with other videos, and make sure you subscribe to the channel and check out the podcast. My gosh, we've got so many resources available. That's because you are in charge of your own health. So let's make sure you educate and empower yourself with the knowledge. Until next time, take care.